Okay, let me start to have the class. Did you like the midterm? Yes? Oh, this is great. This is always great to have like this message from the students for the professor, like, oh, we really like the midterm. And also knowing that it was not completely easy. Actually, it was very, very many of, questions were quite hard. And we were working hard with Jamie on that. Like, there will be a lot of questions in the way that you are also learning from the midterm. So this is another thing that I always like, that students are learning from the tests. We already have everything done with the grading, with the midterm. You have to thank you to Jamie. You already know that she's the excellent teaching assistant. Let's do applause to her, because you will have already done the grading for the midterm and grading for the presentation also. We just do the last check and it will be open for you, distributed afternoon. So you will receive the email that is distributed. So later afternoon today you will have that. There were actually a few questions that I understand that was technically some technical problems in the questions, and some of 2 questions that we didn't completely discuss in the class. So they were from, I don't know, they just came there from cyberspace somehow. So we were aware about that, and you were not penalized for that. So it was in the way that you were receiving the points for that. If you answered that correctly by accident or something, so you were keeping your point, and if you didn't, so we were just not counting this 2 questions. So you were receiving points for that. So it's adjusted for these 2 questions, and 1 question was a technical problem there. So actually 3 questions you have adjustment in your midterm in that positive way for you. So that's something that I wanted to share that with you. So and also let you know that we really check very carefully all the questions, how the students answer that. If this looks like, oh, it's 0, nobody answered that, why nobody answered that? And then we will find out, well, it was because it was the technical problem in the question or anything like that. Or maybe the question, the topic was not covered in the class. So based on this, the gradebook is done with your midterm. So it's I'm actually very, very pleased with the results. You are really excellent class. I mean, it's for a long time I didn't have the great class as you are. And I know both of us, me and Jamie also, we are just so excited. So I just wanted to let you know. So we have to give applause to everybody here, okay? Give applause to yourself. Okay, and please continue. Don't fall asleep now, like thinking, okay, that's fine, it's covered. No, so just be excited, be motivated from that, and continue in that way. So it really looks like I'm so happy to see many future great public health providers in this class. So I just wanted to let you know this. And with presentations also, the grade book is uploaded. I mean, it's everything there, and it will be distributed at the end of today, okay, Thursday, yeah, okay. I know there could be probably some questions regarding the research paper, so I will start first with the lectures, and then we have a little bit time at the end, so I will just check with the research paper, with the rubric, and I will have another few minutes I will spend on next week, Tuesday, in case, again, if some of you will have questions. Please remember also I have office hours. I got a little bit back my voice. It's still not 100%. I was talking so much at the American Public Health Association conference in San Francisco, so I lost my voice, but I'm getting back now. So I will have the office hours if you have any questions. So I will be happy to answer that. And also Jamie, she's excellent in that she is giving you completely her time to help you, that you are, getting excellent in this class and you learn that as much as possible. Okay, so let's start now with the chapter. So chapter 16, it will be talking about problem about the diet and physical inactivity. I also have today for you prepared 10 minutes, maybe a little bit less, video clip from Dr. Dean Ornish. Any of you ever could know that name or heard about Dr. Dean Ornish? Nobody? Okay, so we will be talking about, because he is trained as a cardiologist, but he was always interested in wellness and preventative approaches, how to prevent the diseases. And so he was able to do the like reversing heart disease and reversing diabetes. He also has his Preventive Medicine Institute in Sausalito. He's taking also internships there, so you may be interested in that. And he is also associated with the UC Berkeley University School of Medicine there. So that will be the short video clip that you will be able to see about lifestyle medicine and connection for preventative things for chronic diseases. So you already know about diet and physical inactivity, and we already talked a little bit like this is the lifestyle medicine, or it's like the integrative medicine that will be the most important part in the future as a part of public health. But also, you know, you learn in public health that it's very important to do the assessment, how we can assess the people if they are, you know, leading healthy lifestyle. So some kind of forms of assessment, like you compare if you, before you have the diagnosis of the disease, and if you compare the access in the medical offices that before diagnosis is done, so then also they take like your blood test, so you know about the cholesterol level, blood sugar level. So this is the assessment. So in public health, we have to do also assessment about the lifestyle modification. Yeah.
And how accurate is the BMI index? Because I know it's a little bit off for people who have a lot of muscle density. Mm-hmm.
Yeah, this is, yeah, you already started before I, you know, was coming to the topic, which is excellent. Thank you so much for your comment. Yeah, so the surprise, yes. So this is one measurement, and of course it's accepted, and it's like the basic measurement to do the body mass index. But you will see on the following slides that we have to do more accurate, like percentage of body fat that your classmate already mentioned, because through the you can see also the step-by-step a little bit changes in the assessment. Because before the body mass index was developed, they were just comparing the weight and height on its own, or just the weight, like what was the weight of the person. Then they realized, yes, of course, it's not, is it really accurate? Because as your classmate mentioned, the lean body mass is heavier than the percentage or the fat that the person has in the body. So can we really compare the weight or body mass index completely if somebody who is really athlete, exercising, has a lot of lean body mass because of that physical activity, and somebody who doesn't have that, but because it's the fat in the body which is lighter, it's probably the same amount of the weight on its own. So therefore, they try a little bit to move that in the way to do body mass index. But again, this is just the basic assessment, but it's necessary to do additional measurements. So for you, you need to remember now the basic things about what are the range of being healthy and not being healthy. This slide is giving the information in the general terms, because it's also changing by the age. So through the age, it's a little bit changing if we would like to be accurate. So this is the basic information, but if we will have the client or patient and we would like to develop the program, we have to also use the tables that they are connected with the age group. And additional things that you can see that here, we also need to know what, in case we will diagnose, okay, this is the obesity. What is the shape of the obesity? Is it apple shape? Is it the pear shape? Which one do you think it's more dangerous for, or not dangerous, it's increasing the risk of development of chronic diseases? The first one, that shape, or the other shape? Apple, yeah, okay. So why is this? Because it's the concentration of the fat is around the abdomen area. So it's much higher risk for development of cardiovascular disease because it's in that area. Waist to hip ratio, this is another one. I will just jump quickly to this and then I go back. Another thing that is very easy to do the measurements. Everybody can do that at home. The public should be more educated, because it's already, based on this, is also, it's connected a little bit with the apple shape or the pear shape. If you compare the waist and hip ratio, you already know, based on this, is it possible that maybe there is higher percentage of body fat around the abdominal area? So maybe this is the higher risk of development of chronic diseases. So this is also a very useful thing. And also you can see there are differences based on the age. It's not like excuses completely with the age, but physiologically the body is a little bit changing. So it's also the waist and hip a little bit changing. But this is probably one. If you do the measurement and you would like to know that it's really accurate, the best thing is the combination of more the measurements and compare that. That will be probably the best, my answer to your classmate that asked the question. If I go back to epidemiology of obesity, so yes, based on, and here on this slide, again, you can see how important it is to have the numbers in public health. So now you are understanding the previous chapters, why I needed to learn about the numbers. So if we see the way it's going, what is the trend, it's also almost like alarming for public health providers. Oh, we have to do something about that. And if you look like, of course, on the gender, on the ethnic level, also on the social economic situation. So if you look on that, these are the few things that if they are connected with increasing risk with the obesity, it's probably also when you think like, well, what about the social economic situation? Because it also depends what type of food they can buy, if they are living in the areas that they can do physical activity, is it the thing that they have more education, that they know why it's necessary to change the lifestyle, do different lifestyle modifications in order to prevent chronic diseases. So everything you can see, this is like the whole model getting together, knowing the information, how to prevent or how to decrease the risk of obesity. By the way, also, I hope you know that one of the increased risk for obesity is not enough of hours of sleep. So, and we have the population that it's deficient in, of hours of sleep. So because and we will be not sharing, I will not sharing this information completely here, how the biochemistry and pathophysiology is working, it will be in another class. But if there is not enough of hours of sleep, of course, it's the stressful situation. And stressful situation, stress on its own, it's actually helping you to survive in that environment where you are. So it means that it's slowing the process of metabolism and doing also the alert, activity. So the deficiency of sleep is connected with higher risk of obesity also. So if we already know about that, I mean, if you look also on all the information that public is receiving, mostly everything is connected with nutrition and with physical activity. Not so many people are talking about stress connection with obesity, because from the stress also, if the person is high level of stress, maybe they will be doing the comforting eating. So they eat because to comfort from decreasing the problem of the stress. If you are in high level of the stress, you have also low level of the serotonin. So it's the neurotransmitter also causing the feeling that you are not comfortable feeling, you have anxiety and all of that. So what the people are doing, mostly trying to eat the food to compensate for that deficiency of serotonin. So with the sleep also, so we should much more now start to educate public about not dieting program shouldn't be only the nutrition, but also recommendation, sleep enough of hours. This is the basic one. And there are studies already showing if people start to sleep as they should sleep, that amount of hours, they can much more control their weight. And we are now in society that nobody is probably sleeping more than 6 hours, or majority of the people are sleeping less than 6 hours. Just the question, during the midterm time, I hope not connected with my midterm, but previous midterms, how many of you, you know that you were, or you know somebody who was sleeping less than 6 hours per night? Oh, look around you. Look around you. See, almost, I mean, yeah, majority. So, so this is something, but again, you are in the age that you are still young, the body can adapt quickly. But if you will become adapted to this lifestyle and you continue in this trend, it's possible that if you continue in that way another 10, 15, 20 years, that can be a risk, you know, with slowing the metabolism process and higher risk for the obesity. So I already mentioned this one. Oh, this is another very useful table to, you know, to help with measuring with the risk of the obesity. This is the table that was, it's showing, or it was used. It's about the heart rate. And if the person realized like, oh, what is my heart rate? If you are in that group that is like below average, or poor or very poor, so it means if this my heart rate it's quite high, it means I'm not doing enough of physical activity. It means that maybe because I'm not doing physical activity, I can make assumption from that it's the higher risk for increase the obesity. Actually, there were studies done, especially in the some of the age category here. They found out if the men were in the group of higher heart rate, they had higher risk for development of the prostate cancer. So I would like now to do the exercise. I know you are probably the first group, age group, 18 to 25. Is somebody here younger? Oh, you are, okay. So, well, yeah, you have to still be in this group, 18 to 25. So I would like that you will start, I will just check on the, on the time, and I would like that you will start to count your heart rate for 10 seconds, and then I will multiply that by 6. Yeah.
I just have a question about resting. Some people say resting is sitting calm. Some people say resting is just woken up. I just drank a cup of coffee.
Mm-hmm.
So I'm like,
okay, yeah, this is good comment. I wanted to actually let you know that in case some of you will be in that average or below average, don't be surprised so much or thinking like, well, frustrating from that, because you are not in that resting, but you were already walking, coming here, so it's not completely accurate. But as your classmate mentioned, the resting on its own, therefore in order to prevent any biases, it's good to do that measurements few times. So maybe in the maybe couple, you know, days, every day in the morning before you get up from your bed. So before, you know, of course, it's not resting like having a cup of coffee, because it's already changing that. So before you do any movements and you get up from your bed, that will be probably the best that you can do the measurements in order to know that is because it depends what kind of activity you did before. So the best is to do that for a few days and do the average on that. So see the trend of that. So today it's just preliminary, just making you a little bit aware and curious that I should do the measurements and know where I'm standing. So everybody knows how to measure your heart rate. You can measure that here, or you can measure that here, also with more fingers, not just one, because then you can get palpation of tendons instead of what you need to measure as a heart rate. Okay, so everybody knows that, how to measure that? Okay, so let's prepare to be ready. I will tell you when you can start and when you can stop. So be ready. Prepare. Start. And stop. So just how many of you from this class are happy with your results? Nobody's happy? Okay, well, you know, okay, so it's so happy, slightly happy. Who is slightly happy? Somebody of you slightly happy? Okay. Well, again, I just wanted to let you know that, of course, you are in the class, you are excited, you were walking, so that's so that's one thing. But I don't know what, because maybe if all of you would like to be excellent, it's still quite okay if you are excellent, good, or above average. So any of that, we're thinking that if it's like excellent, good, and above average, it's something like being happy. Any of you be happy? Some of you, okay.
It's I'm supposed to be happy.
Yeah.
I checked my resting heart rate before. Mm-hmm. I always do it in the morning. I try to do the health thing weekly. Yeah. It's usually like 45, 50. Right now, my heart is 180 beats per minute.
Okay.
This is some good shit.
Okay, okay. Yeah, so, yeah, of course. So that's one thing. Therefore, we are taking like, this actually, if I think about that, it shouldn't be, therefore sometimes people, I mean, what you are drinking, it's not coffee, is that right?
Yes, it is.
Is it? Okay. Okay, espresso, okay. Okay, so that's connected. So that's connected. Therefore, sometimes because what's happening, sometimes it's to public, that they don't sleep enough of hours, and then, of course, they don't rest enough, and then they have still the whole day in front of them, and to finish so many tasks. So what's happening is, because if they are tired in the morning, they need, and you can hear from many of the people to tell you, well, I need to have the boost, I need to have the coffee, I need to have something to wake up. So it shouldn't be in that way. You wake up because you wake up from resting sleep, because you have enough of hours, you rested, you have energy, and you woke up, and you don't need to have any additional things to help you to wake up. So if you feel in that way that, yes, I need to have this and this because I need to wake up, that's something wrong. So please don't think like, oh, it's the... And remember the words typical and normal. We have that with the aging. You remember the curve, but it means it's not normal. It's probably typical that people are doing that because it's deficiency of sleep and multitask activity, and people are suffering from the Harris syndrome, so constantly complaining, not having enough of time. So that things are to make you a little bit aware and concerned. Yes, if it's the situation like this, that's the connection with that I didn't lead my healthy lifestyle. So thank you so much for your classmate to mention that, because you can see how it's jumping actually the heart rate by consumption of any of that legal stimulants, which is the coffee. It's included in that. So this is the thing that we should be aware and keeping this table in our mind. So you have exercise, you can do that and check that over the weekend. So what are the health risks of obesity? Why we are all the time, talking about the obesity? Because the obesity is connected with development of higher risk of chronic diseases. Chronic diseases, you can use the word chronic diseases or chronic degenerative diseases. It's just the same. Cardiovascular diseases, cancer, diabetes, arthritis, all the diseases that they are, long in the process before we have that disease, but it takes long time to have that. You already know a lot of information about the obesity and connection with the children. You also were able to hear that presentation from the guest speaker about the obesity and diabetes. So that's the problem, that it's going in this direction. With the diabetes too, that's really a very difficult situation at this moment, that how come diabetes 2 can be connected with the young population. When I was at medical school, I graduated 1980. I know it's a long time ago, but if I would take the test, and on the test would be written like, we didn't have the multiple choice question, but we have the oral exam, and if I will answer to the professor like, yes, diabetes 2 can occur with young population, I will not pass the test, because it was just like, just completely connection diabetes to only this population older than 50 years old. So that was never before. It was diabetes 1, of course, but no connection. You can think like, oh, maybe that was not done enough of screening or the tests, but even if the tests were done, it was quite rare. It was not possible, you know, to see the connection. Yeah?
On the previous slide, would those be examples of etiological risk factors for obesity?
The etiological factors for obesity would be not proper way of the eating, not enough of the sleep. So they are end products of the obesity. So we have first, if you think like what is the trend of the disease, so the etiological factors to first have obesity, or even if you think etiological factors, for example, for cardiovascular disease, what are the etiological factors? So what was before, all the factors that they were before. So maybe it was high level of the cholesterol, high level of the blood sugar. But this is again laboratory test. What was completely before? Completely before was that maybe the person was consuming high dietary fat intake, saturated fat. Or maybe not eating enough of fruits, vegetable, grains, and beans. Maybe high level of stress. Maybe no physical activity, sedentary lifestyle. Maybe exposed to any toxic components. So they are the etiological factors. Thank you for the comment, and you know, just that I can mention that. Also, the etiological factors, the beautiful from the public health perspective. If you compare acute disease and chronic disease, we can do also a lot of things from public health perspectives, because I always call it like it's the beauty. The beauty on the chronic disease is you have its multifactorial disease, multi-etiological factorial disease. So there are many factors that needs to be connected in order to have the chronic diseases. And so if you think about that, it's amazing what is the adaptability of the body. Of course, you can get maybe the genetic material. So it means like, yes, it's higher risk because of, you know, the family and the genetic background. So you have the higher risk. But all other risk could be minimized. So it means that the genetic material will be not expressing maybe the disease, or the symptoms will be very, very light, or it will take time before will be the expression of the disease. So that's the beauty on that. So when we called and talk about etiological factors, it means what was everything in the beginning before maybe the obesity came, or maybe the cardiovascular disease. If we talk about obesity, it could be etiological factor, and it could be also like the opening the door, so something like prerequisite. If we talk, you already have like prerequisite for this class and this class. So obesity, you can see that like, oh, this is the prerequisite. We don't use these terms in public health. Actually, I'm using that first time now. I'm surprised myself. I'm using that. Well, maybe it will be in the future. But at this moment, we call that like increasing the higher risk. But we can call that like this also. So I would like that you will remember the etiological factors connected with chronic diseases. It's everything what is connected with the lifestyle. Is it quite explanatory? Yeah. Okay. Diet and nutrition. So if you look on that and think about type of the food that you were eating or you were not eating. So nutrition on its own is a lot of research studies are showing, yes, if there is the healthy eating style, which will be based on that new food pyramid also, and just generally fruits, vegetables, grains, and beans, is something what is healthy. So this was one food pyramid before the new pyramid was developed. So that was a little bit like the answer for the old pyramid. I will be talking about that later. If you look on that, it's a little bit different way structured. So you can see a lot of on the part here, it's you can, on the bottom here, you can see like, well, it's the physical activity. And then going up there, and you can see also dietary supplements, water intake, glycemic index. So this is something that you probably were able to hear from our guest speaker on diabetes. So this is the food. If the food has high glycemic index, so it means that if you consume the food, you quickly will get high level of the blood sugar. So any idea how you can decrease that? I mean, of course, not to eat that type of the food. But for example, if you have potato, and you have potato peeled and not peeled. So if it's not peeled, it's not causing that high glycemic index. So it's dietary fibers there, and it's helping you to keep the blood sugar in the balance. If the potatoes are peeled, it's the food with high glycemic index. So the same like you have that information about the brown rice. So do the brown rice, that rice on its own, but because of that dietary fibers there, you are decreasing the glycemic index. This is the new pyramid that you are familiar now with that. Before it was developed this, that was another pyramid that was explaining how many servings of the food, and there was no association with physical activity. If you look on that, do you think something is missing there? I mean, if you will be like the public and you just look on that and thinking, oh, I would like to eat, based on the type of the food pyramid. Is there something, of course, that can be ethnic food and everything, but just something basic that you think you don't see that there?
Water?
Yeah, thank you, yes. How come? I mean, because it's quite interesting. I have experiences with some clients and patients that even on the previous food pyramid, they came to my office and I saw like last 10 days, they didn't consume any water. They still have juices and soda drinks and everything. They told me, oh, I'm drinking liquids, but they didn't, realize the need to drink the water. So water is missing here. If you look on that previous one, the water was there, of course. If you go through different countries, they have the modification of the food pyramid on the type of the food that they are consuming, and it's a little bit modified. But if you look on that, great is that we have the steps there. Great thing is that it's interactive. You can go to the website and you can go through this, and it's helping you, and it's interactive part. But water is missing. So be aware about that. Could be a question on the midterm. So what do you think about that? Could be on the midterm too. Is it true? Are there all of that?
For some people.
Yeah. So yeah, because some people like, here the person believe, yes, I'm eating, what I should be eating. Yeah. Dietary surveys, so it's also when the surveys is done and, talk with the public. So it's still the direction that sweetened beverages are still quite popular. So therefore, based on these assessment, there were changes done in the, on the basis on the school districts, changing the sweet beverages for milk or for juices, fresh juices. So when you look on that, it's therefore we need to have the surveys to see what is the trend of the population, how they are eating. So now to do, you as a public health providers, you need to do promoting healthy eating. So how are you doing that? What kind of strategies you will be using? So there are some different strategies. That was different campaign, like 5 a day. So 5 servings a day. It was fruits and vegetables. Food labeling, it's the information. One time I have also the client that he came to my office and telling me like, well, I'm eating based on the colors. And so he told me like, he was like 92, 93 years old. So just to check if it's doing everything right in the lifestyle. And of course, he was, because he was not seeing the physicians, being completely healthy, walking and eating based on the colors. So he mentioned like always I need to have yellow and red and green, different colors. And So when I mentioned this in the last years in the class to the students, so somebody from the student told me, oh, based on the colors, this is great. So it means I can eat the brown color, that is the brownies. Okay, I don't know if I mentioned that here, but I repeat sometimes myself. So breastfeeding. That's very, very important because studies are showing if the child, if the mother is doing the breastfeeding like 8 months or 1 year, it's possible to decrease the risk of development of diabetes for the child. So when we look on that, we already have education, everything, but we still need to know how to get the message out. What do you think? This was probably, I think it was like 4 or 5 years ago. It disappeared, and when I saw that, it was on the milk, on that 3-gallon milk container was this advertisement. So what do you think about that? What is the message giving to the children, to the child? So if the mother is telling like, yes, you need to drink milk, so they think, okay, got milk, I should have Oreo. But Oreo, it's unhealthy because it's partially hydrogenated fat, saturated fat, high level of the sugar, so that's wrong. So what kind of, this was for, believing or not, this was the message like that, and then it disappeared. So it's also another thing is very important from the FDA and USDA also to check, what is the labeling? Can we allow some labels like that? So we have so many restrictions about that, but this is, got milk, get Oreo, having and connected this with the labels, labeling of the food. So what if there is not enough of education even for the mother, and even if the mother would like to persuade the child like, yes, eating healthy, it depends on the age of the child, will tell like, well, here is the information and here is the Oreo. I know we are laughing about that, but it was really a couple years ago I saw that in the store, so I really have to take that and make the scan from that. So what are the ideas to do with the nutritional approaches? So many of the public health providers, they think that we should learn a little bit from the tobacco industry, and not completely from tobacco industry, but how the public health providers were communicating with tobacco industry. What kind of changes were done in order to decrease the consumption of tobacco, that we should concentrate on unhealthy type of the food. We have to, of course, educate public, but to do also additional public health policy. So what do you think about taxes on soft drinks and other junk food? So this is the, like thinking like, well, because now it looks like we think about that type of the food or fast food restaurant, that the food is not expensive. So people will be going there and buying this type of food. So if we will put taxes on that, simultaneously probably type of the food which is healthy, we should make that more affordable to the public, that they will be buying that healthy food. Yeah.
Well, this is like, I think chapter 2, the controversies of public health.
Yeah.
Putting a tax on this might decrease business revenue, might cause jobs. So think about it.
Yeah, thank you so much for that comment. Yes, this is therefore, it's written there like the tobacco control program, because it's the similar situation. It will take time also before realizing for the maybe restaurant owners, yes, if we have the healthy food, we will still get the public, the clients to come to our restaurants and buy the food, if it's also affordable, the food. So, and they can make that affordable if they will have more clients. So it's based on the business. But it will take time. And thank you so much for sharing that. Yes, that's exactly. Now the thing is, should we do something about that and help the public with public health policy with eating healthy food? Physical activity, so we have lifestyle modification is one part. How you can decrease the risk of development of chronic diseases is nutritional part. Then of course physical activity, because it depends how much calories you are, what is the caloric intake and what is the caloric input. So we also need to be connected with physical activity. Studies are showing that any form of physical activity are decreasing the risk for chronic diseases. In general, well is decreasing the the obesity on its own, but also it's improving the blood sugar level, improving the cholesterol level, so it's decreasing that, so it's prevention of the diseases. How much exercise? I know that the general term was like coming from the American College of Sports Medicine. It was like 30 minutes per day to do physical activity. Believing or not, I have sometimes patients that they told me, oh, I am not doing more because the recommendation is only 30 minutes per day. Okay? I know you are laughing about that, but you can get message like this. Well, if you really talk with American College of Sports Medicine, why they recommended, 30 minutes or they increase that a little bit, the idea is if you can do more, if you can do and use every opportunity to any physical activity, this is the best for you, what you can do. Why they decided for some kind of message giving to the public like this? Because they realize what the working person can do. If we will tell them, please do as much as you can, it's not general terms. It's not some kind of like prescription. If people will think like, oh, I can do how much I can do, usually they will not do completely anything. If there is specific prescription, yes, 30 minutes or 45 minutes or 1 hour a day, so they can see some specific numbers. So they can try to go for that goal. So it's the usage of strategies in public health education and promotion. So if this information came out, it came out, this is the recommended. This is the, based on the research, done the recommendation. If the person is doing this, is decreasing the risk. This is the minimum that you start to decrease the risk and can make the difference to develop or not to develop a chronic disease. But if you do more, it's more beneficial for you. So that's the information a little bit. I'm not talking about the addiction to the exercise activity, like it's connected with anorexia nervosa, so that is completely paradoxical, different part, but I'm just talking about the healthy physical activity. So this is, and you can get that information and asking questions from the public. They will ask you, why is that 30 minutes? So if I do more, it's not recommended. So you have to be prepared and explain with this information. So this is just based on that research literature showing this is that can start to make the difference. But you can have more if you do more physical activity. Promoting, how you can promote physical activity, of course, not just by education, by using different strategies, but also helping with the environment. So that's very important. So if I do education and I promote physical activity and the public is living in the area, there are no parks, no physical activity possible to do, so how can they be involved in that? Okay, what are some of the environmental factors that discourage Americans from eating a healthy diet? Any comments from you? What do you think could be the factors that they are discouraging? Yeah. Yeah.
Media. Well, the media.
Yeah, media. Yeah. Media advertisements, yes. So I hope you future public health providers, some of you will be in the media as a public health provider, and you will change that. You will be just, doing great media about eating broccoli and explaining why, or eating, the garlic and explaining why, and all of this. Yeah. So if you, and just do another homework, just, through the weekend, if you are watching TV, see there are a lot of advertisement. What type of food is advertised? So it's probably rich in calories and calling like satisfaction, but is it really satisfaction? It's probably short term of that. Yeah, so that's, and also, what is the cost of the food? Yeah.
Also like social, because eating out is like social.
Yeah, it's also social, so we should have more or chains with restaurants with healthy food. And also what is important, it's probably your network. So if you are, having friends that they are not eating that type of the healthy food, you probably could be influenced by that. So if you look on that from public health perspectives, what all the factors could influence that, and also when we talk about etiological factors, that's part of the etiological factors. How is the network done? How is the media done? So it's connected with that too, okay? Any comments? Okay. So what do you think? Any changes increase your physical activity level? What do you think can increase? Yeah. Yeah, of course. If you are going to science library, they have 6 floors, okay? Yeah, you are laughing, but can you imagine if you need to go and see the book or something, and you maybe, can go there? Or how actually you should be happy and fortunate if you forgot something in the library and you have to go again. Don't be upset, because if you are upset, it's increasing stress level, decreasing metabolism. Be happy and thinking, oh, that was the purpose. I can go 6th floor again, and be happy about that. I know you are laughing, but it's true. Yeah.
Park far away instead of trying to find a closer parking spot.
Yeah. That's also, it's, and another thing is, I hope that maybe some of you will be the future developer or, in development of the, in urbanization and everything. Think also about that, and maybe some of you have that experience when you travel in European countries. When you go on the stairs, you have there paintings and nice things. Here, unfortunately, I know if I go and I walk to the 6th floor in the science library, it's like, it's scary, no? You don't have any paintings there, anything. So that's, and I think that could be maybe, I hope, maybe some initiatives from public health students to do, some students will be doing paintings and just, nice paintings to put, or some kind of nice things to put around that stair, so the person can go walk, and it will be like nice, environment. If any of you have experience when you travel in Europe and you have to walk on the stairs, that it's nice, it's enjoyable to walking on the stairs. Any of you have experience? You have some? Yeah. So is it good or, yeah?
Oh, it's really cool, but I went to a building in China. They have a joke on the bottom floor, and if you want to see the answer, it's...
Oh, this is good. I love that. Okay. So, well, think about that. You can do some initiatives, or maybe to have some kind of, research project that to develop something like this, and then do survey and to find out how many people are using the stairs to compare before. So, and you have research, and that can be quite interesting, and hopefully this can promote that in many of the libraries or other universities will be using. This is great. Yeah, I like that. Thank you so much for the comments. So see again how important it is for public health provider to travel different countries, getting the ideas and maybe applying that. So this was quite interesting to have about the joke. So what do you think? If there will be something like that in the science library, you will be probably running on the stairs because you would like to know what is the end of the story. Yeah, okay. Okay. So this additional thing. So there are additional discussions and links that I will recommend that you will be going through that. Now, chapter 17, injuries are not accidents. So what do you think about that? Is it possible? Can we prevent all the injuries? But some of them can decrease, yeah.
Like I've experienced in more susceptible to
Okay, okay. So yeah, so again, it's very, very important to do some preventative things, some preventative measures. Okay. So mostly people were thinking, well, it's, the accident is the accident and injury just happened, but you already are in public health and you already know, yes, we can prevent many of that, or we can decrease the process, what is the end effect or the situation from the accident. Leading causes, so this is also very important when there will be some questions about this on the midterm, so be sure that you know about that. So if you look on that, motor vehicles, firearms, poisoning, falls, suffocation, drowning, fires, cut, so many of that things, if you look on that, we can prevent them. We can really apply the preventative things to that this will not happen. Then, of course, we have additional like injuries, like intentional or unintentional. I will be showing also to you short video clip about that. Before we will talk and showing the video clip, it's also very important what is the pyramid in the injury. So if you look on that, we have, of course, on the top is the death. So this is something we would like to prevent from public health perspectives. We would like also to decrease the process of hospitalization, how many days the person needs to be in the hospital. So these are the things, if you compare back, primary, secondary, tertiary prevention is the same things here. If you remember still the chain of infectious diseases, and you were thinking what is the agent and what is the environment, you can apply that. You already know for chronic diseases, but you can apply that for the injuries also. So primary, secondary, tertiary prevention. You need to know this because in case there will be situation, you need how to deal with that, and also for the midterm. So primary prevention will be, you know, some people can have the injuries because of consumption of alcohol or anger. That's another quite situation that can cause the risk for development of the injury. Secondary prevention, so that we have the seat belts, and tertiary to, you know, have immediately the emergency care. So when we talk about the prevention or the things about the anger, I wanted to show you, it actually came to my mind to show you quickly the video clip on that anger situation. I think it's quite important for you to see that. Oh. Okay, this is few minutes, just the anger management. I would like to show that to you because I think it's very important for you to see that from public health perspectives, because many times, and it's connected with the injuries also, many times we are thinking, well, if people are suffering and connected with the anger, what can I do as a public health provider? Yes, it's very important to educate public about changes, how they feel about the anger, to do something about that, providing education for them, helping them with different strategies, because anger is quite connected with many level of the injuries. So I would like that you will see this video clip, and then we talk a little bit about that. Oh.
John Stossel found some people actually taking. Of course, we're also told we shouldn't keep our anger bottled up inside. So which is it? John Stossel found some people actually.
Okay, it looks like I have. It's not in the beginning.
Our anger bottled up inside. So, of course, we're also told we shouldn't keep our anger bottled up inside. So which is it? John Stossel found some people actually taking lessons on how to lose their temper. Or not. We'll let him explain.
There are lots of angry people around. So what should they do about it? Then, like this? Many people believe humans are a lot like pressure cookers, that we need to let off steam sometimes.
You didn't even say one nice word to them.
Jim Gergenti believes that.
Make believe you have someplace to go. Come on! As far as I'm concerned, there's no excuse for bad driving.
So when you see bad driving?
I talk to myself a lot. Don't let him in. You didn't even put a signal on. Get over, get over, get over.
Jim and his family live in Philadelphia, where Jim works for an internet company. A lot of the time, Jim's a good husband and father.
Yeah, what's that?
But he also spends a lot of time snapping at his wife Jan and their 2 kids.
It's hard as a rock. What are you going to do here? Which would matter. Whatever possessed you to do that? Then I think you need to spend some time in your room.
Jim doesn't think there's anything wrong with his anger. He feels it works for him.
And how come you're not out of your uniform yet?
And many people believe that this
You want to stay in your lane?
is healthy. Ex-Marine David Morgan recently opened a new business in Los Angeles dedicated to helping people vent. Though not at people. For just $8, customers get to spend a few minutes beating on this dummy.
This is what this is for, the top. This can be a situation, an incident, a person.
I gave it a try. I thought about my boss, my older brother. I like this. It was a good workout, but would this reduce anger?
Whatever you carry, you don't want to go home and give it to the kids. You don't want to give it to your wife.
And people say this makes a difference.
Yes, it makes a big difference.
Carolyn Amos says it does. She's tried all kinds of other things.
I walk and I meditate, and they help. They help get the stress out, but it's nothing like hitting the dummy. I mean, you just really have to whack something.
She says she's always gotten angry in traffic, fuming at the delays, screaming at people who cut her off, until she did this.
The anger just wasn't there. I think it went into the dummy.
Well, the venting here takes just minutes. Other methods take days.
I'm not going to hold it in anymore. I'm going to let it out.
Yeah.
I'm going to let it
Yeah.
out.
Yeah.
I'm going to let it out.
Yeah. Yeah.
Yeah.
People pay $800 to spend 4 days in John Lee's anger release workshop.
Yeah. Yeah, open your throat. Yeah.
People yell, throw things, scream into pillows.
How does hitting the pillow, throwing the pillow, make a difference? You know, most people are trying to get this, man, I'm glad I got that out of my system.
Other cultures have rituals for release, he says. In Japan, they have screaming contests.
And the one who yells the loudest wins the prize.
So he does it here in his increasingly popular workshops. Florence Brown suffered through a long divorce. As the legal process ground on, her husband refused to leave their house, and Florence put up with it. But now Lee encourages her to express her anger.
What you teach people to do feels a lot like a 2-year-old throwing a tantrum. Yeah, in many ways it is. They'll go, oh, I'm so angry that my truck is out of batteries and it doesn't work, and I'm so angry. So I get it out and it's done.
Lee argues that it's not enough to talk about angry feelings. We hold anger in our muscles, he says. So to release it, you have to get physical.
Squeeze as hard as you are angry for people not seeing you. And just seeing the outside and not seeing the inside. Now why don't you just say the phrase, see me? Yeah.
Not anybody else me!
Michael Blair knows he has an anger problem. Still, he thought venting at an anger workshop was ridiculous. The therapist had to talk him into it. Now he can't get enough of it.
Oh, see me already!
You can see what a release it brings him. Makes sense that this is a good thing for angry people to do.
It's a seductive theory. It does make sense, but it's a myth. There's virtually no scientific evidence to support it.
Brad Bushman's a professor of psychology at Iowa State. He's among a number of social scientists who now believe venting's a bad idea. Any kind of venting is bad, they say. Venting at people or even inanimate objects. Sure, they say it'll make you feel better, but the feeling won't last. It'll just make you more angry the next time. To prove that, Bushman recently recruited hundreds of college students to test whether hitting this punching bag would really make them less angry later. First, he had each student write an essay, which was then evaluated by an unseen partner.
So this is your partner's evaluation of your essay.
Actually, there was no partner. Every student was told, this is one of the worst essays I've ever read.
I'll be back in 2 minutes. All right.
Then Bushman had some of the students hit the punching bag. Others were told there was some technical difficulty at the lab.
Unfortunately, we're having some problems with your partner's computer.
So they just sat here for 2 minutes. Then both groups got a chance to get back at their partner by blasting them with a loud noise in this computer game. If the venting theory were right, students who had a chance to vent their anger by hitting the bag should express less anger later. But they expressed more. They pressed the buzzer down twice as long as the others. The students who just sat there were less aggressive.
All the advice I hear is that if you're angry, you gotta vent it or it eats you up. It's bad advice. It produces harmful effects. It's bad for society.
Most researchers we talked to agreed with Bushman, and other studies have gotten similar results. But how does that explain the benefits people say they get from venting? Remember Carol and Amos and her anger and traffic?
I drove the next day on the freeway, and people were, about 4 people cut me off, and I started laughing at them.
And Michael Blair says this helped him more than years of talk therapy.
It allows me to live without anger all the time. It allows me to have a body that's not wrapped by tension.
I showed our tapes to Dr. Bushman.
How's that feel now?
A lot better.
She feels a lot better. She might feel a lot better, but what's happening here is she's learning how to behave aggressively. It's like the old joke. How do you get to Carnegie Hall? Practice, practice, practice. How do you become a very angry person? The answer is the same. Practice, practice, practice.
But John Lee isn't phased.
If they want to believe the research, fine. All I know is I've done this for 10 years. Nobody's came back and said, I went and killed 5 people. It's your fault.
So who do we believe? Well, now some experts on anger say there are different kinds of anger disorders. That there are people who overvent and others who undervent. That these are different problems and therefore they should be treated differently. An underventer like Florence, who's mostly repressed her anger, may benefit from being encouraged to get it out in a safe way. On the other hand, an overventer like Jim, who already vents at the slightest annoyance,
It's green.
needs to learn techniques to control his anger.
Get over, get over, get over.
Does this accomplish anything? I mean, does this make you feel good? Thanks. And do you feel confident?
Accidents, higher risk injuries for pedestrians in that Turkey, maybe in the country. So how can we?
He's not, says his wife.
He's gotten out of the red light and beat on somebody's window. I don't want to go places with him sometimes.
At one point, Jan became so unhappy with his anger, she threatened to leave him. All the experts say venting at people, especially your family, is a bad idea.
Those are your handprints, right? Aren't they?
After a while, as Jim watched himself on our tapes, he started to think that maybe he did have a problem.
And how come you're not out of your uniform yet?
I wouldn't want somebody talking to me that way. I've got to learn to back off. Let kids be kids. What goes through your head? What are the thoughts when you do get angry?
Jim agreed to attend this anger management workshop at the Albert Ellis Institute in New York City. It's run by Ray DiGiuseppe, who tries to get people to exchange their angry reactions for something more useful.
So have you done much problem solving? Not to this point.
Comparative studies have shown that this kind of anger treatment clearly does work for overventers. First, Ray tries to show them how their anger affects their relationships.
The most negative consequence of anger is that it impairs interpersonal relationships. In the long run, in the short run, you get people to do what you want.
Jim, for example, uses his anger to keep his kids under control.
That's a terrible job.
But his shouting doesn't get the kids to clean up the next time.
Yelling and screaming at them and embarrassing them isn't really going to solidify the relationship or get them to behave better.
In fact, Ray tells Jim, your anger actually keeps you from solving your problems. He asks Jim to try a different approach. Next time, says Ray, when driving home, change the way you think about things.
Let me expect that they're not going to do what I want, and let me figure out how I'm going to handle the situation.
In the next session, he tells Jim, give your daughter a choice.
Either clean it up or you you don't watch TV for a night, 2 nights, no computer or something.
Real consequence.
Right.
Okay, now is there any way that she talks that I could do that, be more like her?
She can call me an idiot a couple of times as you're going up the stairs.
Okay, ready?
Mm-hmm.
Oh, Dad, you're such an idiot. Why don't you just let me watch the TV? I'll do it when I'm done. I'll do it later. You know, don't bother me with that, Dad. I'll do it later.
All right, that's it. No TV. Go to your room.
Oh, Dad, you're such an idiot.
That's okay. You still have no TV.
How angry did you feel then?
I felt no anger.
Why?
Because I came to the realization that I was not going to accomplish anything by having a verbal battle. I know how to handle the situation.
Jim attended 4 of these sessions in 4 weeks.
Have they helped?
Absolutely.
What have you learned?
That I should stop and think prior to acting.
You had to go to a workshop to tell you to stop and think?
Well, sometimes you need the outside influence to make you see the light, as it were.
We checked back with Jim and Jan 3 months later. Jan says Jim is still too angry, but things are better. Jim's thinking more and yelling less.
John Stossel is with us now. Now, if you don't have a dummy to bash, and I mean, I could bash Charlie, but he's no dummy. What do you do? How do you vent your anger?
Me?
Yeah.
Like when you called me a stiff this morning on live TV?
Oh, it's easy.
I hold it in. I give myself back pain, I think.
I hold it in.
As do I. We're 3 for 3 on that score.
Okay. So, what do you think about that? Did you like that? So, could you see the position of public health provider in that, to doing like we have different sessions about the management, so it's very important to decrease, one of the process to decrease the injuries could be also the anger management. So it's very important part of public health. Any comments for that? Was quite clear? Yeah, okay. So, very important things you need to remember for injury prevention. They are the 3 times E: education, enforcement, and engineering. Okay, education is very important. We need to educate. The anger management was already the education. Enforcement. So when we talk about seat belts, so that's also like we enforce. Enforcement is actually public health policy. And then we have the engineering. So we will add additional tools that will help us to be involved in that preventative measures. So this is already about the motor vehicle injuries. So when we think about that 3E, so it means, yes, education, that's the recommendation, what should be the speed, also the manufacturer, how they should prepare and manufacture the car, and also additional policy, they are involved in that. Okay. So we already talked about, so if some of you are wondering and thinking, oh, about the speed limit, does it belong also to public health? Yes. So that's the public health policy also recommending speed limits. Why there are different speed limits, like when you go through the city or through go to village or you go here on the campus? Yes, because this is already to be aware that, do the preventative measures. If you are in the lower speed, it's a lower risk that can be some kind of injuries or any level of the accidents. Another part, like how to prevent and decrease the injuries, it's talk about the pedestrians, motorcyclists, bicyclists. How many of you are wearing helmets? Or you know somebody who is wearing helmet when you are riding bicycle? Some of you? Okay. Just 2 days or 3 days ago, I was reading an article, it was on the BBC, that was quite surprising in the way that they were showing the bicyclists in Germany. And in Germany, they were not wearing helmets. So they they cannot put it to the policy. They think if they will put it to the policy that people will stop riding the bicycles. So you can see also it sometimes depends on the cultural aspects. Hopefully it will come to the point all of them, if they did a survey, they accepted, yes, there is the higher risk. We can have risk of injury if we are not wearing helmets, but we don't want to wear the helmets. So you have to deal with some situation like that, you have to deal slowly with maybe the new generation, younger children, that eventually that they will come to that level of adulthood, they will be wearing the helmets. About the pedestrians, you probably notice here that it's really the infrastructure is great here in the United States about pedestrians. So there are the signs, there is the noise, there is always like who is in the car, it's giving and asking the pedestrian first to cross the street. If you will be traveling in other countries, especially like Czech Republic, it doesn't exist there. So you as a pedestrian, you are in charge. You have to run quickly through the street. Otherwise, nobody will be waiting and letting you, yes, you have the right to cross the street. So be aware. Try to always explore whatever country you are going, because this is something what is still missing there. It's a little bit connected with the cultural aspects. You were showing like, yes, so you know that from other European countries?
Well, from Turkey. I went to Turkey last summer. It was crazy. They just they'll run you over.
Okay,
if you don't
yeah,
get out of the way, they don't care.
Yeah, I know always I have some friends or relatives coming from Europe coming here. So the first day they are running, through the streets here, and then I realize they are surprised. How come nobody's going even walking from right to left and just walking on the, so it's not possible in some of the countries.
There's not really good sidewalks either.
Yeah,
So you're
yes.
in the street, you just have to really be careful.
Yeah, so this is another thing that we need to be aware, and eventually this should be, establish these forms like that. Yeah, this is again, it's quite self-explanatory on its own, that could be prevented, these injuries. Occupational injuries, so of course, therefore we have the specific public health policy in that work site. Also, if the workers are going to the work, they have to, the first time when they have the meeting, so they also, before they will start to work there, there is forms that they need to sign also that they have the education about the risks in that work site, if they are, and how the company were trying, or what if they are following the public health policy. So this is the survey. How many of your classmates use seat belts, wear bicycles, adhere to speed limits, smoke detector? So if I ask about smoke detector, so everybody has that? You are even not thinking about it because it's like the part of the public health infrastructure. But again, if you travel to different countries, European countries, did you see the smoke detector in every apartment? No, you never see that. So this is again, I mean, we take that here like, oh, it's always like that. But in many countries it is not. So this is the public health infrastructure that you need, to think also about that and apply if you will be working in different countries in the public health field, how to apply this information there. Here are additional discussions that I would like that you will go through the website and you just, explore that, how to prevent the injuries and what can be done about this. So I will finish presentation or lectures on that level. I just wanted a few more minutes. I will do again on Tuesday, but I wanted to ask you if you have any questions regarding the research paper. This is the rubric here. I know that some of you were sending to your teaching assistant and also to me some questions about the etiological factors. So now probably when I explain a little bit the etiological factor for the public health problem, you are probably more now aware about that. So etiological factors, it's everything before that problem occurs. So it's environmental factors, it's networking, it's peer pressure, it's lifestyle, what you are eating, or it's the public health infrastructure is established or it's not established. So all of this is like etiology. So what is the etiology of the problem? What is in the beginning? What kind of factors? What everything needs to be connected together in order to occur the specific problem. So any additional comments? I will be talking again about that on Tuesday, but any comments to the rubric when you are going through your research paper? Yeah?
For public health in the future, does that have to do with our problem or just in general?
No, it is your problem. Yeah, so that topic what you have, everything, the whole paper is about that topic. So you can do that, what you are thinking. That is also in the future a little bit your opinion and your thoughts. So whatever you were able to get from other research information, so you can put that there. How you will see what the future should be leading to prevent the problem. So it's your problem, it's not the general level, no, yeah.
So your opinion should only really be in that last part.
Yeah, so yeah, because remember also I would like that the opinion are at the end, your thoughts. The reason is because first you get a lot of background, you get that information, you have to educate yourself, you do all the analysis and everything, and then actually at the end is from everything what you learn, how you would like to apply, what will be your recommendation. And please feel completely free and be proud also in case you will find something that you think it's like the new initiatives or something like, well, I would be probably solving that like this. That's fine because it's your thoughts, your opinion. You don't need to describe something what was already done. So it's the creative things, and sometimes you could be surprised, but it happened a few times that some kind of creative things like that or initiatives were sent to public health department and they were not thinking it. They didn't come to that idea that maybe this can be solved like that. And you will learn more this in public health too, that public health providers, if they are already working in public health department, it's very, very important for them that they are open-minded. So they are always getting whatever information they can get from the public, because sometimes they don't see that, but the public, it's possible they will find the solution for that. So be creative in that. And if you think like, well, it can work like that, base your knowledge and ideas, so that will be great. Yeah. Any additional questions? Everything is clear? You know the problems. Also try a little bit, if you pick up the problem, not to make that too much on the general level, because then you will be like, you have so many research papers, the background information, and you can get lost in that. The paper could be for pages and pages, okay? So do like this. Okay, so that's the end of the presentation. I'm letting you go under one condition: smiling, thinking about healthy food, and being happy that you can have your class as far as possible, okay? Enjoy walking.